That 30-second giggly high from a silver balloon is actually the sound of your brain cells starving of oxygen and your nerves losing their insulation. Welcome to this explainer. Today we're looking at a terrifying neurological crisis that's basically hiding in plain sight. We're going to decode the precise, cautionary, and neurological reality of recreational nitrous oxide abuse. Here's our clinical roadmap for today's explainer. Anatomy of the high, the B12 biochemical blackout, myelin sheath destruction, subacute combined degeneration, and finally, diagnosis and reversing damage. Let's get right into it.
Section 1. Anatomy of the high, the 30-second dissociation.
So you might be wondering what's actually causing that fleeting, familiar euphoria when someone inhales from a balloon or a whippet canister. It feels like this brief, slightly psychedelic detachment. But what's going on with your neurotransmitters? Well, let's dive into this. Nitrous oxide acts primarily as a non-competitive NMDA receptor antagonist. Now, NMDA receptors in your brain are normally activated by glutamate, which is your main excitatory neurotransmitter. It's responsible for sending active, waking signals all throughout your central nervous system. But when nitrous oxide hits the brain, it blocks these receptors. It literally shuts down excitatory glutamatergic signaling. This pharmacological blockade is the exact mechanism that creates that briefly intoxicating dissociated state. It's essentially mimicking the mechanisms of clinical anesthetics, kind of like ketamine, right there in the user's living room. But we have to contrast that sophisticated synaptic blockade with a much cruder physical reality. When you inhale nitrous oxide directly from a balloon, the gas physically displaces oxygen in the alveoli of your lungs. So right alongside that NMDA antagonism, you're inducing acute hypoxic spells. You are quite literally starving your brain cells of oxygen. And sure, the brain might quickly recover from that temporary lack of oxygen once you take a breath of normal air, but a much darker, invisible threat has already been triggered. Section 2. The B12 biochemical blackout, cellular starvation. While a person is coming down from that high and oxygen is finally returning to their brain, an irreversible, deeply destructive chemical reaction has just kicked off at the cellular level. Let's walk through this precise biochemical cascade, because honestly, this is where the true danger lies. Vitamin B12, which is scientifically known as cobalamin, contains a vital cobalt ion right at its absolute core. In your body, it normally exists in a functional +1 oxidation state, but when nitrous oxide enters your bloodstream, it acts as a powerful oxidant. It violently oxidizes that cobalt center. Actually, it shifts it from a Co-I state to a Co-3 state. This completely strips the vitamin B12 molecule of its enzymatic function. The vitamin is still physically floating around in there, but it is entirely inactivated. It's literally like having a key that perfectly fits a lock, but all the teeth of the key have been filed off. It just doesn't work anymore. Now, what's really interesting about this fallout is how that single chemical alteration completely halts two critical enzymes in your body. First, it stops methionine synthase, which breaks the cycle that converts homocysteine into methionine. Second, it inhibits methylmalonyl-CoA mutase. Without these two enzymes doing their job, your body's cellular metabolism just crashes. Your DNA synthesis gets impaired, and as we'll see in a second, the very insulation that protects your nerves can no longer be manufactured. The really crucial point here is the terrifying speed of this toxicity. Studies show it takes a mean half-time of just 45 minutes for nitrous oxide to completely inactivate human hepatic methionine synthase. 45 minutes. That's it. And the recovery? It takes over 4 days for the body to resynthesize that enzyme once the nitrous oxide is totally out of your system. This isn't just a brief interruption, you know? It's a long-lasting, highly potent shutdown of your metabolic machinery. And serial exposure, doing balloon after balloon, prevents the body from ever catching up. Section 3. Myelin sheath destruction, uninsulating the nerves. So what actually happens when your body can't synthesize methionine anymore? Well, we see a split pathway of destruction. On one side, the drop in methionine completely halts the synthesis of myelin. Myelin is that absolutely crucial fatty insulation wrapped around your nerve fibers. It's what allows electrical signals to travel efficiently down your spine and right into your limbs. Without methionine, that insulation degrades and it cannot be repaired. On the flip side, because the cycle is broken, homocysteine begins to rapidly accumulate to toxic levels. This toxic buildup acts like a dual-pronged attack. The massive elevation of homocysteine creates a highly prothrombotic state. In simpler terms, it promotes dangerous blood clots by causing endothelial dysfunction and platelet activation. Meanwhile, the accumulation of methylmalonic acid, or MMA, inflicts severe oxidative stress directly onto your now exposed, uninsulated nerve fibers. Think about that for a second. Your nerves are literally fraying while bathing in a highly toxic, acidic environment. Clinically speaking, this demyelination presents with some glaring red flags. It usually starts pretty quietly, just a simple tingling, a pins and needles sensation in the fingers and toes. But because this is a length-dependent peripheral neuropathy, it creeps relentlessly upward. Patients start to experience progressive numbness. They begin losing their fine motor skills, dropping everyday objects. If a doctor tests them, the deep tendon reflexes and their lower extremities are severely diminished. They basically start losing their balance because their brain is no longer receiving spatial signals from their feet. Section 4. Subacute combined degeneration, the spinal cord manifestation. Zooming out from the peripheral nerves to the central nervous system, we hit a condition known as subacute combined degeneration, or SCD. This is where the damage reaches the spinal cord itself, resulting in a severe progressive myelopathy. The chronic starvation of active B12 literally eats away at the posterior and lateral columns of the spinal cord. The dorsal columns, which handle your sense of vibration and body position, they degenerate. And the cortical spinal tracts, which handle your actual physical motor movements, they deteriorate too. The spinal cord itself is structurally falling apart. The neurological literature highlights a very sobering reality here. The abuse of nitrous oxide leads to an impaired methionine production that significantly disrupts the myelin essential for nerve function, leading to permanent polyneuropathy. This isn't a temporary hangover we're talking about. This is a state of severe motor axonal loss, characterized by profound limb stiffness, hyperreflexia, and widespread nerve dysfunction. While some early symptoms can be treated, the axons themselves, the very wires of your nervous system, can be irrevocably destroyed. Did you ever realize that heavy users of laughing gas are arriving at hospitals unable to walk because their spinal cords are literally demyelinating? Seriously, think about that contrast for a moment. The absolute triviality of inhaling from a cheap party balloon, juxtaposed right against the horrifying reality of a young person sitting in an emergency room, paralyzed in their lower extremities, facing permanent spinal cord damage. It's wild. Section 5. Diagnosis and reversing damage. The clinical reality. When these patients arrive at the ER unable to walk, there's a massive diagnostic trap the doctors have to avoid. A standard blood test for vitamin B12 will often look perfectly normal in these patients. Why? Because the B12 is physically present in the blood. It's just chemically oxidized and completely inactive. It's a functional deficiency. To reveal the devastating truth hiding underneath, doctors have to specifically test for elevated levels of methylmalonic acid and homocysteine. Seeing high levels of these specific biomarkers is what proves that the B12 pathway has completely collapsed. Once diagnosed, the treatment protocol has to be incredibly aggressive. First and foremost, immediate and absolute cessation of nitrous oxide. You absolutely cannot out-supplement active abuse. The primary medical intervention becomes high-dose, intramuscular injections of vitamin B12, often cyanocobalamin or methylcobalamin. These are administered daily or weekly to just flood the system and bypass those oxidized stores. But I've got to issue a stark warning here. While these massive doses can halt the progression of the disease and reverse the psychiatric and sensory symptoms, if the patient has suffered severe motor axonal degeneration, those motor impairments may be entirely irreversible. You can put out the fire, but you cannot unburn the house. The mechanics of our nervous system are incredibly resilient, yet astonishingly fragile when they're subjected to the wrong chemistry. What seems like a harmless 30-second thrill is, biochemically speaking, a catastrophic assault on your cellular metabolism. With recreational use on the rise, we really have to ask ourselves how many invisible neurological crises are walking or struggling to walk among us right now. Protect your nervous system with real science. Click that subscribe button right now. See you in the next explainer.